Hi, I'm Madison, and this is canine heartworm disease. What is heartworm disease? It is a potentially fatal parasitic disease caused by infected mosquitoes carrying foot-long heartworms that lodge themselves in the heart, lungs, and associated blood vessels, causing edema and vasoconstriction, as well as other stresses to the cardiovascular system. Here is a diagram of how the heartworm enters the dog and completes its cycle and starts all over again. So a infected mosquito will bite a dog, and that dog will carry this infected mosquito with the heartworms, and the heartworms will then affect its heart. So the organs of interest. The primary organ of interest is the heart, and especially the right ventricle and pulmonary arteries. Damage to these areas can cause backflow and pressure changes on nearby tissues, possibly leading to subcutaneous swelling and edema. And the epithelium of the affected vessels can become inflamed or damaged due to the immune response and the physical presence of the worms. And here in the photo you can see those stringy looking things are the worms, and they do take over the heart. The importance. So heartworm is considered a chronic condition. Symptoms will develop slowly over time as the heartworm cycle takes several months to complete. But the prolonged immune response can cause complications such as pyoderma from secondary infections or pruritus if the dog develops a reaction to the parasite or the medications. And again, here's another diagram explaining the heartworm cycle through the infected mosquito to the dog and biting the dog, and then it's then infected. So, discussion. Heartworm disease is common, potentially deadly, and preventable. It's misunderstood as symptoms in the beginning can mimic less serious conditions. And discussion helps with early recognition and prevention. The signs and symptoms. The clinical signs are coughing, lethargy, exercise intolerance, and weight loss. The severe stages are edema, serious fluid accumulation, dermatitis, and if it's left untreated, it can result in severe exudate, which are substances that are received out of the blood vessels due to inflammation in the lung tissues, chronic fatigue, and malignant cardiovascular collapse. The diagnosis. It often involves blood tests, which are serological tests for antigens, chest radiographs or x-rays, and echocardiography, which is a heart ultrasound, and a CBC, which is a complete blood count. So compensation and diagnosis. Heartworms lodge themselves in the pulmonary arteries and the heart, disrupting normal blood flow. The compensation includes cardiac remodeling, which the right ventricle may enlarge, which is hypertrophy, vasodilation, which is the dilation of blood vessels to help things flow easier, increased respiratory effort, and immune responses like edema. Other diagnosis methods include heartworm antigen test. So if they are positive, that means there's an active infection. Microfilaria tests, which are the presence of baby heartworms. And if it's negative, that doesn't always rule out an infection. Chest radiographs or x-rays, you're looking for a reverse D shape of the heart and inflammation, and again, that will show that heartworms are there. And the echocardiogram will display visible, echogenic, or bright colored worms in the heart and the arteries. And here's a photo of an example of heartworms in a dog. So on the left is a normal heart, and you can see in the cavity where the heart is, there is nothing bright, everything is pretty dull, and you can see the heart. But on the right is a dog with heartworm disease, and you can see the cavity where everything was pretty much dark. Everything is now bright or echogenic, and the stringiness is all of the heartworms. And here are my references.